In this video, we're going to talk about cryotherapy. Yes, we're going to talk about standing in those chambers, exposing your body to very cold temperatures, why that might be good for you, and look at its effects on recovery from sports and exercise. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, in this video, like all my videos, all my live streams, I'm not giving you medical advice. This is meant for general information and educational purposes only. I expect most of us have at least seen whole body cryotherapy. That's where you stand in those chambers and the cold air blows. It gets down to 160 degrees below zero. You hold on to that for 3 minutes, or usually if you can make it 3 minutes. But there's other ways to do cryotherapy. There's the ice baths, what's called cold water immersion. There's ice packs, putting ice on your ankle or on your quad or hamstrings, things like that. And these have been looked at for decades as ways to deal with fatigue after exercise, delayed onset muscle soreness, or try to prevent muscle damage. And this has been studied in a number of ways. Again, looking at delayed onset muscle soreness after sports and exercise, looking at ratings of perceived exertion, even looking at markers of blood damage, things like creatine kinase and lactate, or inflammation like C-reactive protein and interleukins. Now, what's thought to be the mechanism of action of cold therapy, whether it's the whole body cryotherapy or it's cold water immersion, it's thought to be predominantly because of vasoconstriction, basically reducing inflammation because there's decreased blood flow to that area, and then that decreased inflammation results as changes in cell metabolism. Now, let's look at the studies out there on cryotherapy in various forms, whole body cryotherapy and cold water immersion specifically. There was a meta-analysis of 27 studies that looked at cold water immersion in how it affects delayed onset muscle soreness. And it did find that cold water immersion did attenuate delayed onset muscle soreness, or DOMS, anywhere from about 24 hours to 96 hours better than a placebo. Looking at rates of perceived exertion, which is basically how hard you felt like you worked, cryotherapy, cold water immersion did lower that, but only for about the first 24 hours compared to a placebo. There was, in that study, no real difference in any levels of those biomarkers, creatine kinase, lactate, C-reactive protein, during the 26-hour recovery period. So they say, yes, it can be helpful for delayed onset muscle soreness, can be helpful for rates of perceived exertion compared to just other passive ways to recover from sports and exercise. And in that study, cold water immersion was the best way to do that cooling therapy. Now, there was a study in the International Journal of Sports Medicine that shows that no, actually whole body cryotherapy chambers do improve recovery markers after sports and exercise. And in fact, muscle pain was 80% lower after doing the whole body cryotherapy. They thought that it reduced inflammation. It had lower markers of muscle cell damage, again, the creatine kinase and the lactate. So those researchers said, yes, whole body cryotherapy can be helpful for recovery from muscle damage, especially with the more often that you do it, just as a way to lower inflammation and get over the pain from exercise. But what both of those studies noted is there's a lot of variability in the studies about how cryotherapy is administered. How cold does it get? How long are the sessions? How often do you do the sessions? How do you induce the muscle damage that you're studying? It makes it really hard to give specific recommendations about whole body cryotherapy. Now, another study in that same journal showed that cold water immersion, which is brutal, I'm sure, the ice baths and the polar plunges, but that was more effective than whole body cryotherapy chambers in terms of accelerating recovery. And that study looked at it as doing it with performance metrics, especially jump performance after exercise. Also, cold water immersion in that study was better in terms of less soreness and higher perceived recovery compared to whole body cryotherapy. Now, one of the types of studies that's thought to be sort of a gold standard in medical research is a Cochrane review, which is sort of a way to do a large review of all of the scientific studies, scientific reviews out there. And there was a Cochrane review that looked at whole body cryotherapy for muscle soreness after exercise. And those researchers concluded there just wasn't enough evidence to show that whole body cryotherapy reduces self-reported muscle soreness, improves subjective recovery after exercise compared to just rest and no cryotherapy. That was in young active males. There wasn't any real studies or data they could find on females or in pro athletes. Despite all the TV segments we've seen on SportsCenter and everywhere else of these elite athletes doing these cryotherapy chambers, that they couldn't find any evidence to show that it was all that useful. They didn't say it was bad, they just didn't say it was all that helpful. Now, one point that is worth talking about is they found really no significant evidence of bad outcomes or adverse events, which is a big deal when you're talking about exposing your bodies to extreme temperatures. Now, it's hard to really know, and the researchers noted this. Does that mean that there weren't complications from whole body cryotherapy? It's completely safe, or were they just not reported in the study? And last thing I'm going to say about this is there is an idea out there that whole body cryotherapy might actually be harmful for recovery. There was a study that looked at recovery from a marathon, and they found that whole body cryotherapy actually had a negative effect on muscle function, perceptions of soreness, and a lot of blood parameters, at least as it was compared to cold water immersion, but it might be no better than a placebo. They, based on their mathematical analysis and how they did it, really thought most of the benefits of cryotherapy after intense training like a marathon seem to be more related to the placebo effect. And that's where this gets tricky, because those studies are very hard to do, because if you're standing in a cryotherapy chamber, it's really hard to blind people to, am I in the treatment group or the control group? If you're getting exposed to the cold a lot. And so it can be really tricky, and different people work harder than others depending on what the type of exercise is. There's just a lot of variability. So I always tell people, try it for yourself, assuming you're healthy enough that cryotherapy is not a big medical risk, and see how it works for you. Do some runs where you do cryotherapy after, some days that you don't. Do maybe after lifting weights and things like that, and see how it goes for you. Then you can decide if it's something that you would like to do. If you like videos like this on health and wellness, orthopedic injuries, sports and exercise injuries, new ways to recover from these injuries, subscribe to my channel, click the bell to be notified when I start a live stream or when I release a new video. If you have an orthopedic injury and you want to see somebody who truly knows about bone and joint injuries in athletes and active people, I'd love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options to recover from injury, not just surgery, physical therapy, and cortisone shots. Go to my website, drdavidgeier.com, go to the contact page to make an appointment to see me. The link to my website and the contact information is in the description below this video. Again, I'm Dr. David Geier. Thank you for watching, and I look forward to helping you feel and perform better than ever.